Está no ar mais um Onu em Ação, uma produção da Organização das Nações Unidas em parceria com a Blue TV. Na primeira reportagem de hoje, você confere em Laos o treinamento das parteiras e sua rotina. Logo depois, você acompanha como na Nigéria o banco de sangue pode salvar vidas. E na nossa última reportagem, HIV. Conheça o programa da Organização Internacional do Trabalho para os lenhadores da Guiana. Tenha um bom programa e até a próxima.
Samapet is one of the first graduates of a new midwifery training program in the Lao People's Democratic Republic. From her base in a rural health center, she serves a dozen surrounding villages. Nanglao's village is one of them. During her last delivery, Nanglao almost bled to death. She had her baby at home without medical support. This time, Samapet examines her and advises Nanglao to go to a health center when she's ready to give birth.
The midwife told me I should take care of myself and eat well, so I will have enough blood when my baby comes. If I feel the baby is coming and I can't get to the health center, she said I should contact her.
Before Samapet was trained, women here were on their own. Experts say that some 350,000 mothers and millions of infants die worldwide each year from complications related to pregnancy and childbirth. Most of these deaths could be prevented with more skilled birth attendants and better access to emergency care. Laos, a poor mountainous Southeast Asian country with a severe shortage of skilled medical staff, has pledged to improve maternal and infant care as a commitment to the UN Secretary General's global strategy on women's and children's health. Closing the personnel gap is the first priority. With support from the UN Population Fund and donors, 140 students, mostly auxiliary nurses, enrolled in a midwifery course. Trainees honed their skills by delivering babies at a nearby hospital under their teacher's guidance. Potentially life-threatening complications occur in about 1 in 7 deliveries. Women giving birth need a skilled attendant who knows how to respond to obstructed labor, hemorrhage, shock, and infection, and there needs to be an accessible referral facility. Before her training, Samapet lacked these skills.
I knew some things before I took the course, but my knowledge wasn't very clear. For example, I didn't know the danger signs. Now I can recognize a dangerous situation, and I can tell whether I'll be able to cope with it or not.
Now she's confident, and there has been a steady increase in clients coming to her health center. Samapet also provides family planning advice and child immunizations. Reaching women in distant villages remains a challenge, but local health volunteers assist health centers in keeping track of pregnancies throughout their areas, and the midwives make house calls when they can. Laos has a long way to go to ensure that all women can give birth in safe surroundings, but the country's new midwives are an important start.
The tension is palpable. It's a matter of life and death here in the maternity ward of Murtala Mohammed Hospital in Nigeria. It's one of the busiest maternity centers in all of West Africa, with an average of 30 deliveries in 24 hours. But something is going terribly wrong with one of those deliveries. And Sakina Mohammed's life hangs in the balance. Midwife Aisha Bukar is desperately trying to help.
I was trying to explain to her that she should bear down because she's carrying a multiple pregnancy. We noticed she's very weak, so set off IV 5% dextrose for her.
Sakina gives birth to her first twin, a healthy girl. But there are complications. The second twin is breech and won't deliver. Dr. Bello Diko, head of obstetrics and gynecology here, fears Sakina could hemorrhage, one of the leading causes of maternal mortality, according to a recent United Nations Population Fund report.
Because of the associated complications, the second delivery should not exceed 5 to 10 minutes.
Sakina labours in pain for close to an hour before the second baby is finally born. It's a boy.
He was very severe asphyxia. He needs oxygen now, and we don't have oxygen here. Let's use the manual one. It's not working. I don't want the baby to die. I don't want her to miss that baby.
But while they're trying to stabilize the baby, Sakina's condition suddenly takes a turn. She begins hemorrhaging and is in need of blood.
She has to receive blood transfusion.
But finding blood is a challenge in Nigeria, says the hospital's head midwife, Farida Babel.
They mobilize people to come and donate blood in the hospital. But now due to this HIV, so we stopped this.
With time running out, Sakina's husband races to find blood.
So all these things takes time and delay, and it causes the death of the woman. That is most of the thing that causes the death of our women here.
His search for Sakina's rare blood type takes him to surrounding hospitals and private blood suppliers. 1 pint of blood costs the equivalent of nearly $70 US. The average Nigerian makes just over $90 a month.
It is really disheartening to see a patient dying for a preventable cause. As far as I'm concerned, hemorrhage is a preventable cause.
Sakina's husband finally locates the blood and he races it to the hospital. He's made it in time, and Sakina receives the blood transfusion. But Dr. Diko remained frustrated by the lack of supply for his maternity patients, and so he successfully lobbied health officials for his own blood bank, something which would reduce waiting times for blood by 75%.
If you go inside the blood bank now, the 2 fridges is almost packed full.
It's an important first step, he believes, but the fight to save the lives of women in Nigeria must continue.
Each and every one of us came out of a woman. As long as there is one maternal mortality, it's a family mortality.
Kwakwani town is located deep in the heart of Guyana's timber region. Getting there is a day-long boat ride down the Berbice River. Loggers work in extremely isolated areas, separated from their families for extended periods of time. Hours are long, and recreation is limited to a basketball game or a night in the local bar, where the loggers' activities can increase their risk of getting HIV. Karlon Kauswi has been working as a logger for over 5 years. He's received education about HIV and AIDS, but is not yet aware of his status.
Well, I'm not really scared of being HIV positive, but if I got it, I wouldn't be comfortable with myself and around friends.
In Guyana, 80% of HIV infections strike people aged between 20 and 49. The International Labour Organization is partnering with the government, employers and workers' organizations to develop workplace prevention programs on HIV and AIDS. Sean Wilson is the National Project Coordinator.
They've got peer educators trained, they've got people who've been trained in peer counseling, and I think it augurs well for the future for our country in responding to HIV and AIDS in the workplace.
HIV counselling and testing services are provided for free in the country, but reaching the loggers working deep in the forest is no easy task. Many loggers have a poor understanding of the disease. They fear the stigma and discrimination that could come from knowing their status.
I wouldn't think that the boss would be comfortable around me, so I feel I might lose my job.
Employers have also been sensitized to avoid discrimination on the basis of the real or perceived HIV status of workers. Court Simeon is one of them.
being HIV positive won't prevent anybody from working with me.
HIV infections in Guyana are declining as the prevention and treatment campaign gathers pace. The workplace programs have reached not only workers and their families, but also the clients of sex workers and the larger community. Manzoor Nadir is the Minister for Labour.
These partnerships have certainly been invaluable to Guyana. They need to be continued because very easily, if we don't continue with the education programs, the testing programs, the programs that encourage safe lifestyles, then there is a great chance that you can see a mushrooming once again of the prevalence in our society.
Guyana is proof that strong partnerships among governments, employers and workers are key to a winning strategy for HIV/AIDS prevention.